Okay. So this is a very important topic. Everybody deals with that on a daily basis. The improvement is concerned, different technology is concerned. We are not utilizing that at all. We are still following the same old message that we learned, and then we get stuck, and then we don't know what to do with the ears, and that goes to surgery, TICA, and all those things. TICA should be banned, in my opinion. It's such a barbaric procedure, and it can be, if we use modern technology, TICA can be very easily prevented. And the best way to treat any disease, best way to treat the ears is don't let it happen. So just, there are ways we can do that. So let's move forward. So what did I do? I learned the same thing that everybody learns in vet school, which is very little. And it was, did everything, cultures, and you do the cytology and all kind of stuff. And nothing was working. Call it food allergy. If you don't have any answer, call it food allergy. Atopic dermatitis. This is all not proven scientifically. So, and then followed all those things, and I had nothing but failure. Just all these conditions. I treat, wait, gets worse and worse, and then you're stuck. So what did I do? I went to the human side, see what they were doing, what was happening. It is a different world. In humans, they have association, ENT association. They have, now I think they have over 14,000 members. Do we have any specialty in veterinary medicine that we can call it ENT? Absolutely not. And that's the biggest disadvantage we have. What is an ear? Ear has so many different cell structures. It has got muscles, ligament, tendon, bones, cartilage, the list goes on. And all we concentrate is skin. And that's the biggest disadvantage we have. So I went to Harvard Medical School, Dr. Paul. He is a leading professor there. He invented the balloon dilation system in humans that changed the entire world. A very good guy, learned a lot. Dr. Kutz from UT Texas, Dallas, learned how to perform transcanine ear surgery, where you do not make any incision and control your disease. All these different people played a major role in what I did. Dr. Lee from Harvard Medical School, he taught me what is autoendopathology is. If we look at some of the conditions, with the use of endoscope, we are going to look at very clear view of the pathology. But what does that mean? When you look at different conditions, that we have to identify before we can even treat it, and that is autoendopathology. All these conditions. Can we identify what these conditions are? And if we can't, how can we treat it? So I was treating ears without knowing what I was treating. Just keep doing cultures, keep doing cytology. Just went nowhere. So this is what we are supposed to see. Once you identify what this disease is, anybody can treat it if you know what you're treating. As a veterinarian, we deal with a lot of different anatomy, a lot of different conditions, a lot of different diseases. Humans, they just deal with one organ, one disease, one thing. We deal with a lot of different conditions. If we know what these conditions are, it is easy to deal and treat. So how do we find out what is going on with the organ? We have to know the anatomy, we have to know the physiology, we have to know the pathology, we have to know the diagnosis, how to treat it. All those steps we do not follow in ear diseases. Do we know anatomy, ear anatomy? The only anatomy we know is ear canal, eardrum. There is ossicular chain, and that's it. In ear canal, there is so many different cell types that plays a role when there is a disease process going on. So, looking at the anatomy here, we know this is a pinna, vertical ear canal, horizontal ear canal, eardrum, middle ear, inner ear. That is very basic anatomy we know. If we look at in detail, each millimeter here has a different different cell types. It changes here, changes here, changes here, changes here, changes here. And they play a role when there is a problem going on. All we look at is ear canal. Is the ear canal open or not? Is there any polyps in there or not? Is it stenotic or not? Is there discharge or not? And that's it. Where is that discharge coming from? Where is the stenosis coming from? Looking at the ear canal, right here is a ceruminous gland. And when there is a disease, we look at the ceruminous gland, it is all blocked. We say, okay, this ear canal is completely clogged. No, you pass this area, you go further down, it opens up. Why is this stenotic and why this is not? We need to know. Looking at the eardrum, how much do we know about eardrum? Eardrum anatomy is very important. Eardrum is made out of 3 cell layers. The cell layer towards the ear canal is a squamous epithelium, because skin comes out, makes 1 cell layer right here. Behind that is a fibrous layer, which makes the eardrum vibrate. Behind that, inside the middle ear, is a mucus layer. So the entire bulla is lined with the mucus layer. When there is a disease, all 3 layers play a role. We will take a look at some of them. Unfortunately, it's very difficult to cover this entire topic, but I'm going to talk about the most important thing that we deal with. Ossicular chain. What is the most important function of the ear? Hearing and balance. Do we even pay attention when we treat the ears, whether the dog is going to hear after we treat the ears or not? No. How about balance? We don't want to get there, it's very scary. Where is that happening? Where is the hearing is happening? Where is the balance is coming from? If we know where all those things are, it's very easy to treat. But if we don't know where it is, what are we treating? We don't know. So this is the ossicular chain. The window, oval window is right here, foot plate is right there. Cochlea, this is where the hearing is taking place. Cochlea has a sensory hair. That is what makes you hear. As we get older, the sensory hair falls off. We don't hear as well. So when we are treating, we have to be careful about what is happening and how we are treating it. Eustachian tube. Eustachian tube plays a very important role. What's the function of eustachian tube? 2 major functions. Mucus layer produces mucus, drains into the eustachian tube, into the nasopharynx. At the same time, there is a ventilation pathway. So the air comes through the eustachian tube, goes around, moves around, and it goes back. If the eustachian tube is clogged, you have a disease problem going on. Okay? And we will look at some of the conditions based on the eustachian tube. So that's anatomy. Looking at this, watch this ear canal. Each millimeter has a different structure, different cell. There is hair that disappear, then it gets hairless. Further down, a lot of ears, they have hair right at the eardrum level. And once you come down there, you can see through the eardrum. So when we are doing the exam, what you need to do is you have to look at the ear from tip of the ear to the tip of the eustachian tube and find where the problem is. So if we look at through the eardrum, all this anatomy we have to identify. Looking at the color, pink, purple, black, blue will give you some idea of what is happening in the middle ear. So this image has an eardrum. This is without the eardrum. How thin the eardrum is. So you have to be very careful when you are dealing with the ear to make, not damage the eardrum. Here is the anatomy that you can see. If you use the visualization, all this anatomy it plays a role in disease process. This is looking at the ear from the bulla, ventral bulla approach. So the eardrum is right here. This is a malleus bone. All this anatomy is very important when there is a disease. We don't get in this environment, but we need to know what is in there. Incision tube open is right here. Chorda tympani is right. Chorda tympani is right. Get back. Chorda tympani is right here. Round window is right. There's so much anatomy going on here. And if we just concentrate on ear disease is based on skin, we are going to get lost. And this is, so these are all different structures with the label name. So here is the incision tube. Opening is right here. That is very sensitive. Incision tube in nasopharynx opens up right here. This is adenoid gland. Right here, you have a blockage. So if you are having a problem with ears and it's chronically giving you trouble, you have to look at entire pathway. Visualization. So physiology. This is what we ignore quite a bit. Ear canal is an organ. It's a functional organ. What does it do? It has got a peristaltic movement. So ear canal skin is going to exfoliate. There is wax production right here. Hair production is right here. All that needs to come out. So over a period of time, the functional ear canal is going to move the stuff out. If there's a disease in the ear canal, that process is blocked. And when that process is blocked, you have ear discharge just sitting there. And you keep wondering, say, I'm treating the ear, why is it not getting better? Because the self-cleaning mechanism has failed. When you are treating the ears, you have to make sure the self-cleaning mechanism is working. Now, again, we talked about the mucus production has to drain right here. Eardrum has to be clean. Acicular chain has to work in order to have a functional ear. So, diseases. As we talked about identification of diseases, how many diseases we deal with in the ear? Infection, foxtail, parasites, mites, what else? Tumor, polyps, production of cerumen. So right now I'm writing a book with a friend of mine. He's an ENT surgeon from UK. We came up with this list. These are the diseases that we treat, we deal with. Yes?
Are there any immune-mediated diseases that manifest in the ear?
It does.
Yeah.
It's skin related.
Okay.
Ear skin, not inside, not in the middle ear.
Okay.
So immune-mediated is an immune-related problem, right?
Yeah.
Not every single tissue in your body is going to react to the immune-related problem. Your kidney doesn't, your liver doesn't, your heart doesn't. So some of the cells will, and so as long as the skin is there, it can't have that. Okay, so diagnosis. How do you diagnose a problem? Number one way you diagnose problem is visualization. You have to see it. If you can't see it, you don't know what you're dealing with. So number one, imaging, what is it? It makes you see things differently. But the endoscope will have a true view of what your eyes see. Okay? And then hearing. We don't use hearing in veterinary medicine as much as we should be. It's a whole different science that we have not touched at all. This field is wide open, and I don't understand why there is no residence or new specialty coming up. So, pathophysiology, what is happening here? Can anybody give me a little hint here, what we are looking at?
Ruptured eardrum?
No? You're pretty close. Okay, so this is the eardrum, pars tensa, pars flaccida. Pars flaccida is retracted. How does that happen? Eustachian tube allows the air to go in and out of the middle ear. If the air gets blocked, the bone in the middle ear uses air over a period of time, long period of time, causes vacuum. When it causes vacuum, what is the softest part of the ear? Pars flaccida. It gets retracted. What happens when it gets retracted? The skin layer of the tympanic membrane gets sucked in. It's a number one precursor of cholesteatoma. What is cholesteatoma? It is a foreign word for us to know. We see cholesteatoma, you guys see, everybody sees cholesteatoma on a regular basis. And we don't know what we are working with. What is cholesteatoma? Cholesteatoma, I have a video later on, but cholesteatoma is basically the squamous epithelium of tympanic membrane gets sucked in. Okay. Now, if there's a missing skin, or there's an incision or cut, over a period of time, skin will crawl, and close the wound. It does it because it has something to crawl on. When the skin here tries to crawl on, there's nothing, it's air behind it. So it starts to grow inside the middle ear. What happens then? It exfoliates, exfoliated skin accumulates. It's an ingrown skin in the middle ear. It's called cholesteatoma. More scientific name is tympanokeratoma. More common name is cholesteatoma. Okay. What happens when the skin grows in the middle ear? It produces two different kinds of chemicals, proteolytic and osteolytic enzymes. Proteolytic enzymes is going to start eating away the soft tissue of the middle ear. Causes tremendous inflammation, attracts the bacterial infection, there's a constant draining. If you have a case that is a pussy draining, quite often it's a pseudomonas, but quite often if it's not responding, cholesteatoma causes that discharge. You keep treating it, it keeps coming back, you keep taking culture, it never ends. Osteolytic chemicals, what do the osteolytic chemicals do? They start eating away the middle ear bones. If it eats away the ossicular chain, you have hearing loss. If it affects the semisecure ear canal, you have a balance problem. If it affects the facial nerve that is going through the middle ear, you have facial nerve paralysis. Cholesteatoma, you see this thing all the time. And I would strongly recommend go and investigate a little bit more. Do your homework, do your study, and find out about cholesteatoma. Okay. Treatment, medical, surgical, combined. Okay, now these are, I picked some of the conditions that you are going to see on a regular basis. Okay. Shampoo reaction. Number one ear problem we treat is because of shampoo reaction. It is so common and so much ignore that condition. You put a scope in there, you can tell right away, so this is a shampoo reaction. And we keep wondering so why the disease is not getting under control. You treat it, gets better, comes back 2, 3, 6 months later, a year later, comes back over and over and over. This is what it looks like on a scope. Mild, moderate, severe. And then once it becomes more severe, it starts causing discharge and yellow pus and all that kind of stuff.
Wait, are you saying that is due to the shampoo they're using on the fur?
It trickles down. So put the shampoo on. I have a very nice pictures. Got on the internet and saw how to wash dogs, and it was all shampooed up all over. You trying to rinse that off, the shampoo water is going to trickle down in the ear. It might be very concentrated, it might be mild, depending on how concentrated shampoo water trickles down. But once the shampoo trickles down, they don't stick hose in there and clean it out. It just little. You want to wash your hair, you put water, you put shampoo. Don't rinse it out completely, you are in a hurry. What happens later on? It itches. And you don't do anything to that over a period of time. What's going to happen? It's going to have inflammation, discharge, all those things. Exactly, that's what is happening here. And if the dog has some hair in there, anterior inferior recess that we are going to talk about, it has old hair built up there. It has got exfoliated skin sitting there, and then shampoo water goes in there. You have created a soggy diaper. Sits there. Yes?
I took a sample of that and looked under the microscope. What do I see?
If you look at
The shampoo here.
yeast,
Okay.
most of the time it's yeast. So if you have yeast problem, work on the shampoo problem, find out how long ago the dog was bathed, what was happening, who washes it. Oh, my daughter washed it last time. How old is the daughter? 12.
How long from the bath do you think you get shampoo here?
It depends on the concentration. Depends on concentration. If it's mild, then it might take a month maybe, like mild version. Okay, what is anterior inferior recess? Yes?
Oh, sorry, I have a question. And if you use an ear cleaner after, should that prevent them developing an infection?
Ear drying solution.
I'm sorry?
Ear drying solution.
Okay.
I don't know how many ear drying solutions I send every week. It's just, and people come back and say, my God, my veterinarian kept treating this thing, it never got fixed, and you fixed it. I'm not a magician. You just dry it up. And it's very funny that they have been treated for drying solution, all that for a while, and then 6 months later, 2 years later, they come back and what happened? Are you using the drying solution? No, we ran out of it. Comes right back. Yes.
Would you use that for dogs with e-collars that have history of ear infection, like just standard symptoms?
So for the washing of the dogs?
The ear drying solution.
Yeah.
Would you do that on dogs that are just wearing e-collars?
Like kind of chronically, where they can't get enough ear circulation?
You can. Again, put a scope in there, you will see whether you need to use it or not. Right. A lot of time you look at the ear and you say, oh, there's nothing wrong. Put a scope and there's a volcano underneath. That's why visualization is so important. I don't know why scope is not part of our decoration in our clinic. Every person has to use. I don't know how many. Julia works with me. How many times we use the scope?
Oh, every day, all day.
All day.
Constantly.
Yeah. And the scope is, here we are talking about the ears, but the scope can go in any hole. And if there's no hole, you can create a hole and see what's going on. But it will open up your eyes. You say, wow. It looks like a person, a human being, saw their face first time. what kind of reaction they will have, right? That's the reaction you get. Oh my God, is that what it is? Okay. I'm sorry. Anterior inferior recess. This is another, I don't know how much time I still have.
Sorry.
Yes,
Do you have a recommended ear drying solution?
ADL. Works, I've used it for years. Every time it's worked, there is probably plenty more. Anterior inferior recess. How many people know what is anterior inferior recess is? Right? This is a very important part of ear anatomy. What is anterior inferior recess is eardrum, pars tensa, pars flaccida. Okay? Eardrum is an angle, 45 to 55 degree angle. Okay? So the ear canal ends here, ear canal ends here. So it is an angle. This one is pars flaccida, is very large. Go back. This is a bony bulge. It doesn't have a name. There's so many anatomy in the ear that doesn't have a name yet. And if anybody wants to name it, I can put it on.
Just name it
So-
after yourself.
How many names? It will be so many. So bony lump. There is a big ceruminous gland sitting right here. This is small, but as the dog gets older, that ceruminous gland produces a lot of cerumen. It sits here. This is a bulge that comes from the TMJ. We'll take a look at it in the Frenchies. And this corner makes a very good trap where things sit and accumulate. If you are using ear cleaning solution, be very careful. I see this problem very commonly, and all I have to do is tell the owner not to use ear cleaning solution. If a person has ear problem, do we have ear cleaning solution? There is none. Why? There is a reason. There is a very good reason. Whoever is manufacturing is going to be sued a million times. We use it randomly because who cares, right? If the anterior inferior recess is impacted, which is very common in the older dogs, you put ear cleaning solution and you leave it there. What is ear cleaning solution? It's a detergent. You cannot leave the detergent and expect, you cannot put 409 on a dirty kitchen counter and expect it to be clean. You have to clean it out. You have to rinse it off, otherwise you're creating a bigger mess. That will create a soggy diaper right there. And you tell the owner, put it once a week, twice a week, every 2 weeks, whatever. You are adding problems. If you are using ear cleaning solution, rinse it off with saline. Every ear cleaning, we use ear cleaning solution, everything is get rinsed off with saline, warm saline. We have an incubator, it's loaded with saline, everything gets cleaned up. And you have bigger problem, you use stronger and stronger ear cleaning solution, and stronger ear cleaning solution is going to give you stronger problems. So here is an example. Anterior inferior recess is impacted. Now we are cleaning this. See what comes out. That's a pump that we are using right here. If anybody wants to see the instruments right here, Matt has brought all of them. Look at this. Now you put ear cleaning solution and make it soggy there, problem is going to get much bigger. Clean it out, there's a foxtail just came out. Okay. Chronically discharging ear. You see this one quite a bit. All you have to do is clean it out. We are looking at it, we put a cleaning solution, this is what is left behind still.
Is that the shampoo reaction?
Could be, it could have started with shampoo. The suction is the most important part everybody should use that. Because it's your finger, it's your hand going in there, doing the same job as your hand. Flushing it out.
What is the learning curve like? Like, how often do people who are starting out really damage the ear doing it?
That depends on your ability, your skill will. And some people will pick it up and go from day one, and some people you say, my God, they should not. And then at the end we put the medication. So look at how different this ear looks like. What I see in general practice is we put medication on top of all that gunk. Doesn't work. All you have to do is just clean it up. What difference it makes is just, okay. Recurring yeast infection. This is long-term shampoo reaction. What happened? Okay. You just look at that. We clean it out with regular ear cleaning solution. It's still a lot of stuff built up. When you clean the ears, go back and look at it and see what it looks like. We are so busy, we just send it to somebody in the back, they clean it out, bring the dog back, give it to the owner, your ears are clean, here is the medication, put it on top of the gunk. Right? Just clean it out. Foxtail. Discharging ear. Go in there, it's all full of purulent discharge. Clean out the discharge, and you will see what is causing all this. There's a foxtail. Just get it out. Looks like a cockroach.
Can you imagine that foxtail on your eardrum? Like, I mean, that dog lived with that.
There's a
I
perforation.
saw like 5 different vets.
Yeah, there's now this is middle ear and there's a foxtail right there. You can't see with the regular scope, handheld scope. Get it out. This is what the eustachian tube, I'm flushing the stuff from the eustachian tube. Okay. Here is another ear. All this discharge, just building up. You can't even put a scope to see what's going on. You clean it out, you flush it out, go deep down in there, get all the discharge out. You have, your scope is moving stuff around. There is a foxtail.
Where is that foxtail? Is that through the eardrum?
Yeah, it's buried in there. Inflammatory polyp. Causes all this kind of discharge. You clean it out. You see the polyp. There's multiple polyps here. This is just a regular hemostat. Get a good grip of it. Pull it out. Now the biggest thing is what is behind it. Polyps are not difficult to take it out, but see how much discharge is building up. And middle ear is still full of more polyps. Polyp is coming out through the eustachian tube in nasopharynx. Cholesteatoma. This is how cholesteatoma looks like. It looks like cheesy stuff. Has a very peculiar odor. Old salt kind of odor. Here is how the endoscope deals with it. Remove all the discharge. Cholesteatoma can have purulent discharge. It might not have any discharge. Each animal responds differently to cholesteatoma. So this is cholesteatoma. Skin is all built up, packed in the middle ear. You suction it out. Now we are flushing it, and watch how much stuff comes out. This is a 45-minute video put in 30 seconds, so a lot of things has been trimmed off. And if you look at it, how much stuff is building up outside. This is in epitympanum, so eardrum is gone. Epitympanum is up north, so there is still more cholesteatoma there. You put your different instruments and get all that thing out.
So is that dog gonna live with that eardrum the rest of its life?
Yeah. Rupture eardrum is not a big thing. Sometimes I take the eardrum off in some conditions. All you lose is little hearing, but otherwise, one thing you have to be careful if the eardrum is gone is water cannot go in there. That's it. Period. Otherwise, you can take off the eardrum. There's a different kind of hearing. So, when somebody's talking to you, it hits your eardrum and makes it vibrate and makes you hear. But the sound wave is hitting your whole body. And the bone that is more exposed, that also picks up. And that's the bone conductive hearing. Over a period of time, body will develop. It might not hear as good, but they will still hear it. So finally, this is how clean you have to get the cholesteatoma out of there. Yeah.
Would you need to go back and check that period of time to see if it's redeveloped, or, you know?
So cholesteatoma, you have 10 dogs with cholesteatoma. You treat 10 the same way. One will never come back and it was fixed, and the other one will come back 6 months later, a year later, and some, no matter how many times you remove cholesteatoma, it will reoccur. So they all behave differently. And I warn people right in the beginning, I don't know whether we're going to fix this, or this is going to be ongoing process that we have to clean ears, discharge, whatever it takes. Problem is, most of the time I end up seeing very old dogs, so there's very little you can do about it. So, anterior canal bulge. This is a problem in Frenchies or brachiocephalic dogs. The TMJ puts a pressure on the ear canal, and you can't even see the eardrum. This is completely clogged up. So here is, and then it produces discharge because there is a pocket behind the, and it just, sometimes Frenchies, they respond the best. You go in there, clean out, if it's cholesteatoma or discharge, they respond very well. I have to do it once, and most of the time it's gone. With the saline, see how much junk is coming out. With the saline, it opens up, so you get to see anatomy, pathology, all those things much better. This is also a very common condition. I call it a feline nasopharyngeal syndrome. I don't know, there's no name, so I just made it up. But when you look at the cat's eardrum, this is what it looks like. We call it cobwebs. Okay. What is happening here is the mucus layer of the tympanic membrane is inflamed and is reactive. You go in there and there is so much junk inside, you won't believe how much stuff you get out. Once you get it out, cat is a different cat. People come back and say, oh my God, you gave me my cat back. Now my cat never meowed, now he meows. So you hear all kind of stories.
What is the presenting complaint with it? Like,
Sorry?
What do they come in complaining about?
Complaining of ear problem, just general ear problem, shaking, discharge. This one doesn't have discharge, but most of the time it's discharging ear canal. And then you have nasopharynx, all reactive nasopharynx. Cerumen infection. So we see those things quite often too. There is a impacted cockroach in there. You just, with the suction, you just get it out. Now, the most important thing is what is causing it, and there is different reasons. There is a perforation right there, and mucus from the middle ear is coming out and then drying up outside and causing the. There is different, sometimes the tympanic membrane, the squamous epithelium is rough, and it just accumulates everything. So there are a few different etiology there. Okay, that was then. This is now. So we have to decide where we want to go to. Right? So we have the more videos on our YouTube channel. If anybody is interested, is informative. Thank you. Yes.
Are there some, common practices that we might have been doing all of our careers that maybe we should stop doing or recommending?
I'm sorry, I didn't.
Are there, do you have any things that we might have been doing as a profession, like really wrong over the years and that maybe we should stop doing?
Very first thing is ear clean solution. Clean it out. Use it, fine. Rinse it off. Rinse it off. There's so many problems involved with that. Yes.
Do you have an anesthetic protocol that you prefer in these guys?
Whatever you feel comfortable. It varies depending on the age. One thing I don't like to do is when they're awake, I don't like to sedate them. They're completely under anesthesia because ear is very sensitive. Even if they're heavily sedated, they will still flinch and jerk. So I just put them in there. Yes.
The cats that wake up after we've cleaned ears with head tilts and stuff, do you have that problem as much as we do?
I never had that. No,
Because
luckily
you're
I
giving it
will have it. I tell people I'll have it tomorrow. The main reason is what I put in there. I'm very careful. And then I rinse it off with warm saline. Cold saline is going to give them head tilt. So if you're going to do the ears, have an incubator and just keep it in there warm. You will stay out of trouble. Yes?
In the last photo, you looked like you were gowned up. Is it for sterile surgery?
That was a middle ear, endoscopic middle ear surgery we were doing, yes. That lasts for 3-4 hours, so kind of keep it sterile.
So you're diagnosing the inner ear with CT? Is that what I saw, the imaging system?
CT is going to get you much better, but first thing is you have to identify whether it's a middle ear or it's just ear canal with a scope. Once the scope tells you that, okay, this is past the eardrum, then CT scan. Yes.
How often do you end up doing things like, biopsies and or then going to like bacterial cultures and things like that? Or are you pretty successful with just what you're working with?
So biopsy is not very common.
Yeah.
Tumors, you can tell that those are tumors, and that's when we do the biopsy. With infection, I very rarely culture. I almost never. Once in a while, I think if I need a better grip on it, then I might culture it. But cleaning, so here's another trick. Yeast infection. Yeast don't like acidic environment. And I use acidic acid, boric acid combination. And if you are dealing with yeast that's going to give you trouble, rather than putting on fluconazole or any conazole, I use boric acid, acidic acid, and you can put it once a week, make the environment acidic. Pseudomonas hates acidic environment.
Okay, that was my other question. It was like Pseudomonas?
Pseudomonas hates, Pseudomonas staff, they don't like it. Yes.
How do you decide when you're gonna cut through the eardrum? And
Cut
then how do
through
you do
the-
it? Is that scary?
You're welcome to come see. When do I decide that I'm going to cut through the eardrum? So, you lift the eardrum most of the time. And the way you lift the eardrum is your ear canal goes down, but 2 millimeters away from the eardrum, I make an incision on the skin. Okay. Once you make the incision on the skin, you lift the skin, and you go to the eardrum, and you start lifting the eardrum with the skin. So you kind of make a lid to open it up. Then you go and work around whatever you need to do, and then you can put that lid back again.
And
That would be
it'll heal back in?
That would be the most ideal way to deal with it. Most of the time, if the eardrum is diseased, it's very tough. If the eardrum is not much disease, it's easily torn up. You can put the graft, tympanic graft, and there's different ways to do tympanic graft. And how do I do it? I have about 200 different tools, instruments that goes for different specific conditions and specific. I don't use 200, I probably pick most, 6 that would do most of the jobs. Yes.
You said for yeast and Pseudomonas, you like an acidic cleaner, but if you rinse it out with saline after, are you losing the benefit of that acidic environment?
So, there are some solutions that I don't rinse it off. pH Notex is one of them to clean the ears. To make the environment acidic, I have my formula that I make it in a bottle, and it goes as a treatment. I don't remember exactly. You can call me and I can give you the probably what. So it's boric acid, acidic acid, and alcohol, and I have them put depending on how aggressive I want to get, maybe twice a week, maybe once a week, once a month, depending on if the dog goes in the water and picks up here and there, then once a month maybe. Yes.
So a lot of owners will say, oh, he got water in his ear and that's what caused the ear infection. Water, just plain water shouldn't do that, right? Or should it?
Well, depends on water. What do you mean by water? Ocean water? No, I've never seen any problem with salt water. If it goes to Mono Lake water, yes, there is a problem. If it's Lake Tahoe, probably not. So it all depends on what kind of water the dog goes in. Any more questions? Well, thank you very much. Thank you, Matt, for bringing this equipment. Please come and see hands-on if you want to play around. Here is your chance. Right? Yes.
One more question. So the
Cholesteatoma, yes.
Is that caused by a pressure change in the eustachian tube? That's what is sucked?
So,
And then how is the eustachian tube damaged? Is it because of oral disease?
okay. So, cholesteatoma, why and how it occurs is still not known. Okay. But having the negative pressure is one of the known precursors, reasons why it happens. Eustachian tube is not the only one that would cause negative pressure. Epitympanum. So the entire middle ear is divided into epitympanum, protympanum, hypotympanum, and mesotympanum. Okay. Epitympanum is dorsal. When you go, if the dog is standing, you put a scope, there's an eardrum, epitympanum is up higher. that is where your ossicular chain is. This is where, when they do tika, that's where they stay away from. All important stuff. That is a very complex environment. Sometimes there is a scar tissue granulation forms, and it blocks certain pathway. When that happens, the pars flaccida area is very common, where it forms a little blockage, and then pars flaccida gets retracted. So you have to go in there and remove all that granulation tissue, open up the circulation. Eustachian tube blockage causing cholesteatoma is not that common in animals. In kids, it does it because adenoid gland sits right in front of them, and they remove adenoid gland tonsils all the time because of that. Yes.
I'm just wondering, Dr. Kureshi, how many of these are you doing a day or a week? Like by comparison, is this one where you're doing a ton a day, or are you doing a few a week? What's your typical?
How many are we doing?
For ear endoscopies, I would say usually one a day. Usually, under anesthesia, usually.
But every
This-
patient that comes in gets.
Gets what?
Does every patient get a scope and exam room? Or not?
Not every single one, but sometimes we have two. You know, sometimes we have none, but.
But the ear exam with the scope is very routine.
Yeah.
If I see anything that's not right, gets scoped.
That's always under sedation.
No, that's awake.
That's awake.
That's awake.
Okay.
If I'm just checking and looking, most of the time we can manage to do quick exam to just get a rough feeling. If I'm doing something else besides just looking and checking, then it's under anesthesia.
Okay.
1 second.
Okay. That kind of answers my question.
Okay. And Tina.
I was just curious, once you've cleaned everything out for whatever condition is there, how much of your therapy is topical afterwards versus systemic, or do you do a combination of therapies?
Well, it depends. If it's discharging pus, then I would say it might go on topical and oral, both. Usually I use Clavamox and I think Clavamox is the most common one. I might use Cipro, combine Clavamox and Cipro if I want to get a little bit more aggressive. Yes.
For just ballpark, not including the anesthesia, what is just like, what's your cost to clients, general ballpark? Just so
average.
you know.
So the procedures that you saw, cleaning and getting all the impacted stuff and all that, it's about 2,000. What do you think?
Yeah, it depends on weight. It starts at about 1,500, but if we do CT, it's usually about 2,800.
Are you sending them out for the CT?
No, we have
you have
CT
one.
in-house, yeah.
Okay, cool.
Uh-huh.
Got it.
It takes 15 seconds to do CT.
Yeah, it's
Nice.
quick, yeah.
That's very quick.
Mhm.
And anybody is welcome to come and see what we do, play around, call me if you have any cases you want to discuss. I'd rather you work with your case and solve and pick up some more tips.
Yeah.
So what are you sending your clients home with for cleaner?
Ear cleaner?
Is it
Why would I
just-
send ear cleaner?
Well,
Because
that's
they're
why
fixed.
If you're not anesthetizing them and
Yeah.
you're doing your exam and you don't, if you see stuff, I guess you anesthetize everybody. But if it's,
So, we anesthetize if depends. Now, today I had a dog came in, 13-year-old Cocker Spaniel, just worst case you can have Cocker Spaniel. And had a heart condition and all kind of stuff. I flushed the ear out without anesthesia. Now, I got most of the stuff out. I could not get the anterior inferior recess cleaned out properly. Now, she did well, But that also requires practice. How far can you put the tip, flushing tip? How far can you go? Those kind of things depends on the cases and experience that you have. Hard to tell.
So then you're just going with oral medication, or are you using the topical?
No, after I clean it out, I send the topical medication. Oral is.
Your homemade brew?
No, I send, I think, Momentum Max or something.
Okay.
Yeah. And this is kind of we are putting a Band-Aid on a gunshot wound.
But you're not having them clean it, you just medicate?
Yeah, cleaning, how are they going to clean? They're going to just pour stuff in there. Then what? I don't recommend them to clean stuff when there's a disease going on. I don't. But on a routine basis, if they have some stuff building up, pH notics, you can sit in there. It's a glycerin mainly, oil-based product. Yes?
What do you think of Clara, the heated and stuff?
I'm sorry?
Clara.
What about it?
Do you use it?
No. I do, but not as much. Clara dries up and creates a very dry layer on tympanic membrane. And it's like using a waterproof tape to tape on somebody. What it causes, I think it does the same thing on the eardrum. So over a period of time, if it doesn't peel off. If you use Claro, I might put something to soften it up. Your Momentum Max or Pulse Attacks or Cerulane, or something to kind of dry skin peel off.
It's usually if they're not tolerant of, like the owners, they cannot put it in or whatever.
But then still, after using Claro, I still go back and on a recheck, I just put a little something, just as a lotion. Yeah, that was a pretty interesting questions. All right, everybody is sleeping now? Thank you.
Thank you.